I'm here to tell you a little bit about where we've come from and where we're going to in terms of our genomics proposition and why it makes a difference for workplace health. If you think about it, it's slightly mad that we wait until somebody's ill until we diagnose an illness. It's mad that we wait to diagnose something until somebody's got symptoms, and that we try and start people on medication with a sense of trial and error, not knowing whether it's going to work or not. And that's worked to a certain extent up until now, but it's also caused some of the variations in care, some of the challenges in terms of accessing care, and a lack of personalisation in healthcare. The environment, it's really changing. So we have a change in digital, in technology, and in consumer expectations. And that's really starting to drive this fundamental shift towards a more personalised approach to healthcare. And it doesn't just mean choice in terms of healthcare. It means tailoring healthcare around the things that make us all individual. Our biological differences, the differences in how we respond clinically, but also our behavioural differences. Now, we're really proud of where we've come from, and that's because we were the first UK private healthcare provider to pilot whole genome sequencing, and many of you will have heard about it, many of you will have been part of that. We're really proud that the products that are currently in the market are embedded and created and tailored in the right way, because we started small and we used the insights from that pilot to be able to trial and to develop products the right way. And some of those insights are that 99% of all of our participants had a genetic variant that affected medication that they took. That's not just medication that you might receive in hospital, something like an anesthesia agent or a chemotherapy agent. It's also things that I might prescribe as a GP, like an antidepressant or an antibiotic, but it's also things that you can buy over the counter, something like ibuprofen. 91% of our participants had a risk related to lifestyle, nutrition, and exercise, things that we all know are important, but when we receive the advice, it's not personalised to us, and it doesn't align with the health goals that we have. And 73% had a risk related to a disease like diabetes, like a cancer, or cardiovascular disease, that we know we can reduce that risk either through lifestyle changes, through screening, through help and advice, or through medication. It's not just the right thing to do, however, it also makes economic sense. 75% of employers say that they're more likely to stay with an employer that offers a personalised health benefit. We also know that pharmacogenomics, which we look at in the medication check, better management because of that has resulted in 39% fewer inpatient and emergency visits in a self-insured population. NHS trials, and this is part of the NHS long-term plan, combining the risk that we use to look at diabetes, cardiovascular disease and cancers, PRS. Now, looking at those with clinical risk factors could prevent up to 45,000 cardiac arrests over 10 years, with a large saving of over 140 million. And we also know that for about every £1 spent on preventative genomics, £3 can be saved in downstream costs. And what I want to do is I want to leave you with this idea of a future where imagine what it's like to go into a doctor's consultation and to know that the medication that you've been prescribed is right for you, that you're being prescribed the right dose, that you're not at risk of side effects, and that you can expect a result from that. But it's also really important for people who might be waking up in the middle of the night worried about their risk of developing something like breast cancer or prostate cancer, worried about their risk of having a heart attack or a stroke. Actually understanding the risk, feeling that you're in control of it rather than it being control of you, is a completely new way of us thinking about healthcare.